this over to our moderator, Susan Flowers.
Okay, well, like as Alan said, it's wonderful to have everyone, and we're very fortunate with the presenter that we have today, giving us information on arthritis and the importance of physical activity. So in saying that, I will give it to Bridget.
Thank you, Susan. Hi, everyone. Nice to see you all again.
Yes,
I'm
you're
pleased
welcome.
to introduce our expert for this month's session. Ashima Narayan is a highly experienced physiotherapist with over 15 years of practice in the USA. She holds a Doctor of Physical Therapy degree and currently works with the Arthritis Society's Arthritis Rehabilitation and Education Program, where she is dedicated to helping clients achieve their goals of health and wellness through individualized care and rehabilitation. Her expertise and dedication in the field make her a valuable asset to the program and her patients. So welcome, Ashima, and thanks for joining us.
All right, thank you. Thanks for the intro, I appreciate it. Like Bridget said, my name is Ashima. I am one of the Arthritis Society representative with Arthritis Society. And today what we're going to do is just talk about arthritis in general. So, and then why it's important, like in terms of physical activity, all right? If you guys have any questions, either we can wait till the end or as it comes arises, we can discuss it, whatever is convenient for you guys, okay? I might not be able to see a hand sign. I know there is a hand sign where you can raise your hand. So if it is, just unmute and let me know I have a question, okay? All right, so we're going to start. If nobody has any questions to start out with. Okay. So Arthritis Society, in terms of Arthritis Society, we focus on all three missions. So this is our mission: research. We spark new ideas and careers in arthritis research, advocacy, innovation, and our big one is information and support. So this is where we are really helping individuals with arthritis. As an AREP clinician with Arthritis Society, our main mission is to educate individuals about their conditions, right? And how to self-manage it so they're more independent and functional with their daily activities. So AREP, it is funded by Ontario LIN. So there's no charge by that means. So if you have the Ontario Health Card, so if you have a OHIP card, consult within Arthritis Society is funded through that. And at the end of this presentation, we'll just go over some information that we have services and how you can access them, right? Now, big thing here is with arthritis in general, right? We'll talk more about it, like different umbrellas, is self-management. That's a big concept just for anything with chronic disease, right? Arthritis is chronic. It's not something that just goes away. It stays. Could it get progressively worse? Yes, depending on the condition itself, right? So self-management is the ability to have the skills and confidence to manage your disease on a daily basis and to manage its impact on your life roles and your emotions, right? And that's what, as we AREP therapists, we try to help our clients with self-management in that aspect. It shows like if you're able to self-manage yourself and be more active with your daily activities, it does have an impact on it because it helps decrease the pain by 20% and decrease physician visits by 40%. And that's what this slide is telling you. Like if you really look at this on your own, that's how many hours you are in 1 year. That's a lot. And hence the self-management technique is important, right? Kind of focusing on yourself, be confident how to manage this condition, right? Because at the end of the day, that's what we want. We want to be able to be independent and not be like, you know, how we would say we don't want to be burdened on anyone else, right? So in light of the importance of self-management, it is important for you to understand the condition and things that help you to live best with it, right? So it's what you need to know about arthritis, and that's what we'll be going over with agenda, right? Physical activity exercises and strategies to manage pain. And I think this is a really important one too. All three are, but I think how to manage it is, again, the whole aspect of self-management. Now, this is what I was talking about in terms of your inflammation, right? Arthritis, there are two umbrellas grouped to it. One is inflammatory arthritis and one is osteoarthritis. As you can see on this, the yellow markers on the screen here are your systemic inflammatory arthritis, like rheumatoid arthritis is one of them. Osteoarthritis is blue, okay? You can see how the joints are different too between the two conditions, right? Systemic, which means it's in your bloodstream, right? It's autoimmune. So the body is attacking itself. So that's what systemic inflammatory means, or like autoimmune condition, okay? Big thing to keep in mind with an autoimmune condition or inflammatory arthritis is, if it's not, like, you want to make sure it's treated. If it's left untreated, like if you keep having that pain and we don't do anything about it because we don't know the condition, it can cause further joint damage, again, because your own body is attacking it, okay? And like I said, rheumatoid is one of the example of an inflammatory arthritis, right? Now, and that's not to say like individuals with RA can also have OA and the other way aside, right? Like you might have the whole rheumatoid arthritis, but you only have osteoarthritis in your hands. And that's when you go to see a rheumatologist or a specialist. That's when they can configure with you what you have and what condition that needs to be treated. So in this presentation, we'll be mostly talking about osteoarthritis, but physical activity and exercise is important for all condition, right? It's not just basic for OA, or like, so inflammatory condition is like a whole huge gamut. We'll just stick with OA, make it a little simpler for us today, okay? Now, does anybody want to unmute and speak out what they might think the symptoms of arthritis is? If I have any takers on this.
Pain.
Yes, wonderful, thank you.
Loss of some mobility.
Yes, true, very true.
Swelling of some joints, like
Yes.
fingers.
Yes, no, definitely, wonderful. So these are the symptoms, right?
Loss of strength.
Yes. All right, so the symptoms for arthritis, it's all everybody what's been said, joint pain, crepitus. The crepitus is that grinding sound that we hear in our cartilages and bone when it's damaged. I think when people bend their knees and you hear that crunching noise or grinding, that's what crepitus is. Swelling, and swelling can happen from time to time, right? Sometimes it's consistent, sometimes it comes and goes. Joint stiffness, waking up with it, but it gets better as the day goes on, going from sit to stand, and you have that knee stiffness or hip stiffness. Somebody said loss of movements, loss of confidence in joint. This we feel it's because when we don't feel strong or the joints don't feel strong, we're afraid to move, right? Because we don't want to have a fall, and that's where that whole confidence in the joint comes in. Now, the next question I want to ask you is, does any functional limitations or difficult activities you might have if you have arthritis? Can you guys think of some? Or that might self-limit you from doing things.
Yeah, difficulties getting up and sitting down again, you know.
Mm-hmm.
Yeah. Dressing.
Yes.
Climbing stairs.
Mm-hmm.
Losing your ability for reaching.
Yes.
Yeah.
So as you can see, everything comes in hindsight, right? Like at home, you might have difficulty doing stairs. If you don't have the strength, or there's that stiffness or swelling, pain, joint pain, putting on socks, like simple things, like if your hands are affected, you don't have enough grip to pull those socks on. And like getting up from the toilet, same thing as a chair, right? Toilets sometimes are much lower than they should be, for that aspect. Work activities.
Sometimes for us, they're too high. Being little
That's
people.
right.
Yes, you're right. So putting on a raised toilet seat, with a stool, it helps accommodate for that height, right? Physical task, getting to work, prolonged sitting, these are all functional limitations, right? Like if you sit for too long and if you have back problems, again, it limits us, right? From sitting for a long time. I'm just going to the movies. That's one thing for social. Going out with friends, not able to wear heels, or prolonged standing. So these are all how functionally we can be limited. But that's not to say, like, some people may also need assisted devices, right, to be able to function. And there's like a cane or a rollator. All right. Now, in terms of joint pain, the pain and the pain itself, the severity and frequency varies depending on individual to individual and the stage of arthritis, right? So not one person is alike. It could be because of overuse or certain activities can trigger the pain. Like if you have to do repetitive stairs or if you're like squatting a lot, right? So that's why deep bends tend to be painful. Joint pain is predictable. There's no way we'll know when we're going to have so much pain, right? Some days you can do stairs and it's fine. The next moment you do them, it's hurting. It is true, it could be worse when there's a change in barometric pressure, like if you know it's going to be damp, humid, and cold weather. We do hear that a lot, right? We know it's going to rain or it's going to get cold because my knees are hurting or my shoulders are hurting, right? And pain can be felt in location far away from the joint. So hip away, like if you have arthritis in your hip, you can sometimes feel the pain in your knees. And that's just because everything works together. It's in a chain. Same thing with your neck, and you can feel it in your shoulder. All right, next one. Now, arthritis. Symptoms of, oh, we did this, sorry, my fault. Arthritis affects more than just your joints, right? So what this means is there's frustration to go with it. It affects your sleep. You're more stressed because if you're not sleeping well, you have fear of the future, right? Like that whole loss of confidence as to what am I going to do or how will I do? How am I going to remain independent? That whole fatigue, low energy, again, because of our sleep disturbance, stress. Some individuals also feel anxiety and depression with this, right? Any questions so far? Okay. All right, so the main challenges with this is also, if you think about it, joint pain can cause interrupted sleep, fatigue, functional limitations, impact quality of our ADLs, like which are your daily activity lives, whether be at work or at home, and also family and leisurely activities. So you can see how this whole thing does not affect you, just that joint, it affects you as a person, right? Now, a little bit of arthritis, what it is. So you have this nice picture of a knee. We're going to stick with OA. So we're going to understand the anatomy of it, right? You guys can see this is a cartilage. And aside from the so cartilage is like a buttress, right? And that's what's supporting a knee. And then surrounding the knee is a capsule right here in the bluish. And then we have the ligaments. So these are all part of knee support. We also have a synovial lining. It's almost like lubricating a joint, just like how we lubricate a car part or a hinge, right? And then in between is our meniscus. This also works as a buttress for our knee, okay? So the capsule and the ligaments, the purpose of both of those combined, which is surrounding the joint itself, it helps to stabilize the joint and maintain the alignment of our knee, okay? Through the ligaments, there's attachment of the muscles, right? So if you take your knees, the muscles in front of your thighs are known as quads. So those muscles need to be strong in order to stabilize our joint. And they're also work as a primary shock absorbent. So they're protecting the joint, especially the cartilage, right? If our muscles are strong, then our joint tends to be more sturdier because it's supported, okay? There's only so much those ligaments will work. And then, they do get that tear and the breakdown. It's important to keep in mind that osteoarthritis affects different people and different joints in different ways. But for the most part, OA doesn't necessarily continue to get steadily worse over time. So again, it could be different for each person, right? Some might get it worse versus the other. For some individuals, the symptoms reach the peak, then they remain the same or even improves. Others find they have several phases of joint pain flare-ups with improvement in between. So when you understand the whole management on how to handle arthritis or how to self-manage it, that's when you can control those flare-ups, right? Now, the picture on the other side, as you can see the degenerative changes in the cartilage, and that is basically causing the breakdown of the cartilage because of overused trauma. You get the meniscus, which is like between your the top bone and the bottom bones of your lower leg. So this is the top bone and this is the bottom bone. So there are two of them in your lower legs. This is the meniscus, it supports us. And if there's a tear in that meniscus and the cartilage, so that bone on bone comes more closer, right? And with the constant rubbing of it, it can cause bony spurs, as you can see to the side right here. All right. And that's how you get, this is what OA is. That's what OA would look like in a progressive condition. Now, cartilage, the reason why we use this sponge is because it's like the prime example of what our cartilage is. If you remember when we went back, it was the one that was surrounding the knee joint. So osteoarthritis leads to breakdown of the cartilage, right? With progressively as it gets worse. We used to call it a wear tear, but it's no longer, we don't refer to it as an wear tear disease because it limits individuals from being physical active. I always say do what you can within your tolerance, right? We don't want you to just stop and sit at home because you're having pain. In fact, the reason for that is because cartilage and bone needs moderate activity, like to load to generate, regenerate itself. Like somebody with osteoporosis, right? It's because the bone density is decreasing. If we don't load those bones, they'll only get more brittle and weaker, right? So same thing goes for this one. Moderate activities within tolerance is okay. Our body needs it. The articular cartilage does not have blood supply. Therefore, to get the nutrients, it does so from the synovial fluid. And it was the lining, remember, the fluid, so there was a synovial and there was a fluid right beside the knee, and that's what's lubricating our knee. Nutritional exchange happens through dynamic loading, the whole sponge theory, right? Sponge up and down. Loading and unloading, for example, like walking and cycling. So when we walk, we're moving our knee, bending forward, and that's what's getting that nutrient exchange into our knee, right? So a healthy cartilage will look like this sponge. When it's squeezed or compressed, it will release the water into the bucket and then it goes right back up, all right? So this process is essential to healthy cartilage and is fostered by exercise such as walking or cycling. This is one of the reasons that physical activity is so important, especially when you have arthritis. Even swimming, I want to add swimming to this too. I think swimming is very important. Cartilage, again, has little to no nerve supply. Remember, we went over that. So therefore, you do not feel the pain. So when you start to, we all could possibly have osteoarthritis somewhere, but we're not feeling the pain because it's affecting the cartilage. But once it starts steadily going out, then we might feel the pain, okay? Now, do we need an x-ray for diagnosis of osteoarthritis? No, it really not. So this is an x-ray of a knee, as you guys can see right here. This is the top bone again, right here, and this is the lower leg, okay? You can see the loss of the cartilage, which is right here, right? Because, sorry, hold on. Sorry, you can see the loss of the cartilage is because the cartilage is broken down, so the bones are coming closer together, okay? Osteoarthritis is a clinical diagnosis, which means it should not be diagnosed based on symptoms, right? Like symptoms like I'm having joint pain, swelling, or stiffness, right? It is not, so it's based on symptoms and examination, not x-ray. So if somebody comes and tells you this, then you got to do that aside from examination, not just purely on x-rays. As we mentioned, the symptoms can present 10 to 15 years before OA shows up on x-ray, right? Because of cartilage, you don't feel the pain. Therefore, treatment is based on symptoms, not x-ray results. And I know a lot of people, we as individuals, we chase after x-rays, but at the end of the day is how you feel. Like you might be different from today to tomorrow. So treating a condition based on symptoms tends to be more effective than an x-ray result, right? Because it won't change the nature of a treatment. Usually the x-ray does not tell us why it hurts. MRI gives us more information about OA, but are not very useful because many findings on MRI are not the cause of the pain. Example, meniscus tear. So that's not, it could be, but it's not. The main thing is just the sponginess, right? The cartilage. X-ray is appropriate when there's pain and function are severe and surgery is considered, like knee replacement. And X-rays are there to rule out any serious condition, like say maybe you are there's a hairline fracture in there, or some kind of a bony growth in there. So those one you would want to look at, all right? Now, risk factors for osteoarthritis. So non-modifiable are things that cannot be changed, right? Age, gender, hereditary, and congenital. Congenital is when you're born with. Modifiables are excess weight, joint injury, muscle weakness, and inactivity. So these we can change. We are in control for this, right? Obesity is a major risk for development and progression of OA, okay? Weight can affect OA through two mechanisms. First, the loading, and second, inflammatory mediator. So now how it affects mechanically is if individual is overweight, it increases the mechanical load on the knee and the hip and can increase or quicken the breakdown of a cartilage. So for joint load, if you really think about it, for every extra pound of body weight, joint force increases by 3 pounds on the hip and 4 pounds on the knee. That's a lot by just 1 extra pound, right? Being only 10 pounds overweight increases the force on the knee by 30 to 60 pounds with each step. So you can only imagine with all that step that you take, how much absorbance of that force the knee has to take. Because as we gain weight or we become obese or overweight, our knee is not expanding with it. Our knee stays the way it is, right? Whatever our structural knee is, it's just the force it's absorbing through it. The excess body fat can also, now the inflammation, right? So there was a mechanical part to this and inflammation. The inflammatory response, so excess body fat can also contribute because of pro-inflammatory enzyme present in our body fat. There is an increased risk for hand OA with obesity, but obviously that's not related to the loading on the hands, right? Because we're not loading ourselves with our hands too much. Now, in terms of joint injury, this is for individuals who have sustained a serious knee injury or any other form of injury to a joint. They're highly susceptible to developing OA. Someone like a sports athlete, if you want to say it, or somebody who was in a motor vehicle accident, right? And they had a serious knee injury, like an ACL tear, meniscal tear. So those individuals are 50% more likely to develop osteoarthritis of the knee within 10 to 15 years. So that's why it is important to adapt to a safe work and activity practices. So we limit that excessive load for extended period of time, right? That's where the whole work safety comes in. Now, muscle weakness. It was originally thought, we thought that weak muscles are a result of OA. So that, although this is true, it has shown that weak muscle causes OA to develop. Weak muscle causes a joint to absorb more shock. Weak muscles affect our trust, our confidence in the joint, right? If you're weaker, we want to avoid activities or anything that will cause us to maybe our knee give out, right? So poor muscle control and coordination can really result in improper loading of our joint and poor quality of movement, which can be improved if you have neuromuscular training done. And a lot of physiotherapists you'll find in the clinics, they have these machines or they'll have you do balance exercises because we're re-educating those muscles how to effectively work. Now, physical inactivity. Physical activity, why we say, because it's modified, right? We can change them. If we're inactive, we can be active if we want to be. Physical activity is necessary for cartilage to regenerate properly, right? Again, dynamic loading, for example, by walking is necessary for the cells to produce the building blocks required to make more cartilage, right? So how we build those Lego blocks, it's the same concept, right? The more we load within our tolerance, we're just building those blocks so you get better cartilage. Physical activity provides the dynamic load required to feed the cartilage and maintain a bone health. Physical activity is vital for weight management, which is a modified risk factors for OA. So if you look at it, it's like the whole chain. If you're active, you improve all this together at the same time, right? Your excess weight, less joint injury because now the muscles are stronger, and same thing correlating to muscle weakness. Now, now this is going back to therapeutic exercises from our agenda. As good or better, as good as or better than medication for pain relief, all right? So studies have shown that therapeutic exercises or physical activity in another way are as good or as better than anti-inflammatory medication or Tylenol for pain relief in osteoarthritis. So regular exercises and just being active, right, physically active will not damage the joint or cause additional damage if done correctly. Now this is where like I keep emphasizing, right? Correct form, and you do it within pain-free limit. Have minimal risk of side effects and numerous positive benefits. Compared to somebody who has a sedentary lifestyle, is known risk factor for worsening of symptoms in all form of arthritis. As I previously mentioned, in the inflammatory arthritis, medications are usually required to control the disease process and ultimately the pain. So this is like little different, right? Like how we talked about osteoarthritis and inflammatory condition. With osteoarthritis, yes, exercises are helpful if you do it correctly within pain-free listen, respecting your pain, listening to your own body for it. But inflammatory condition, right? Because it's your own body attacking the joint itself, you do need to require some medications for that pain management and to further prevent that joint damage. Now, physical activities and exercises are not the same thing. Both are beneficial, but they're different, all right? So physical activity, if you look at this umbrella right here in front of you, is an activity that involves bodily movements done as part of leisure recreational work, active transportation, and household tasks, like yard work. That's a physical activity. Walking to a bus stop, housework, like cleaning, vacuuming. These are all physical activity that keeps us active, or dancing if somebody likes to do salsa, right? Therapeutic exercise on the others are physical activity that is planned, it's structured and repetitive, and it aims to improve one or more components of physical fitness. It is done with the concentration and awareness of posture and alignment. So if somebody, example for this is if somebody's having trouble walking so many kilometers, right? How can therapeutic exercises in terms of like what muscles, what exercise can help you perform that physical activities? And so that's what this site's talking about. They're different, they work together, but you do need therapeutic exercises to help with your physical activity. Now, why, the big question here, now this slide is to why we should be active. Most people are probably aware of the long-term benefits of regular aerobic exercise and physical activity for your general health. Now, the fun fact here is, did you know that 90% of people over 65 with osteoarthritis have at least one or the other chronic diseases as listed on this slide? Heart disease, diabetes, cancer, and so on. So if you have one of these chronic diseases, exercise is part of your treatment. If you don't, then exercise will help. If you don't, yes, then exercise will help prevent you from getting them. Now, so exercise can help everything, right? If you think about it, do you know of any magic pill that can help do all? Like lower your blood pressure, one pill that'll lower your blood pressure, depression, help with diabetes, obesity, or heart condition? Yeah. I'm hoping everybody's saying no. Right? So there is no magic pill, right? It's all about how regular we are with our physical activities to decrease this risk further, okay? Now, there's so many other benefits of regular therapeutic exercises and physical activities for individuals with osteoarthritis. So number one, like if you have OA and you're active, then there's less pain compared to individuals who are not active. So again, less pain. So if there's less pain, you're taking less medications. And the best thing about that is when you're exercising, endorphins gets released. I'm sure you feel that happy feeling once you work out, right? It just gives you a little bit of boost. So it increases your self-esteem, right? Takes you out of that depression or that stress of thinking, what am I going to do? So that's one benefit, right? Exercise also helps improve sleep. And if you sleep better, then you're functioning better because there's less pain. And that helps, it does affect our mood in that aspect too, right? Because if you're functioning better, we have less pain, we're able to do things, we feel better. So people who are active feel better about themselves. Again, greater self-esteem. Energy levels are better with exercises because our endorphins, right, in our body, that hormones that are released after we exercises there tend to be high. Exercise can add fun to your day, right? Like I said, it doesn't have to be regular therapeutic exercises, right? It could be physical activities, like if somebody likes to dance, go pick up their grandkids, or just going for a walk, like walking your dog. These are part of physical activities that does help you and they are fun. If with exercises, it also says less stress, right? Less pain, less stress. So if you look at yourself in the mirror, you'll probably feel better because you're looking better, right? Again, better mood. And the big thing is cartilage. Your cartilage needs to be loaded in order to rebuild. So moderate loads needed to stimulate new formation of cartilage. Remember the sponge we kept going back on? And that's like ongoing research, like how important physical activity is, or therapeutic exercise is for just anybody with any condition. Now, the weight loss, how we talked about, so for every 10 pounds, right, we have 30 to 60 pressure in our knee. So small changes can make a big difference. And this is what the slide is kind of demonstrating you, the effect of weight loss on your knee and hip. So if you lose 1 pound and you walk a mile, there will be 4,800 less pounds of pressure in your knees and 3,600 on your hips. That's a lot if you think about it. And if you multiply that by 10, that's 48,000 less pressure on your hip and 48 on your knees, I should say that, and 36 on your hips. That's a lot of load that comes off, right? And that's why being healthy and working on that weight loss is important. Weight loss of 10% of body weight leads to significant improvements in symptoms, physical function, and health-related quality of life. But even 5% loss of body weight can help with symptoms relief. And there are studies that are saying like like osteoarthritis studies that shows the benefits of people who do lose body fat, and how it can help, right? So getting a stepper, walking on your stepping scale, or kind of measuring how the pant size are fitting you, right? Now, there are 4 categories of exercises for therapeutic exercises, right? Remember, these are the exercises that are structured. So they have like repetitive, how many reps you're doing, how many sets, and how many times during the day or the week. So there is strengthening part to it, flexibility, balance, and aerobic. And if you really think about it, a lot of our physical activities are actually involve all of these, right? So example is just plain old walking your dog. Well, you have to balance with the dog leash and the dog itself, right? Balancing on unlevel surfaces. Your heart rate does go up, so that's part of your aerobic because you're walking. When you walk outside, it's never leveled, it's up and down, and that's where that strengthening comes in. And flexibility, you walk, your trunk is moving, your arms moving, so overall stretching. So the whole benefits of this. Posture is also important for somebody with osteoarthritis. So poor posture will engage in activities you put at risk of further damaging or injuring to both cartilage, joint, and surrounding ligaments. As you can see, these are all a correct way of sitting, except this one right here. This is not correct. It's just causing a lot of loading to that spine, especially our lower spine, which predisposes it to further injuries or pain. So most people with arthritis have difficulty with postural control because of muscle weakness, right? and pain. So that's why it's really important to practice good posture. Using good posture distributes the work over muscles, help conserve forces of joints. So you want to work on your posture as much as you can, right? Like sitting up straight, shoulder blades down and back, and in standing, not hanging on your ligaments. So those ligaments are usually out in the front. You don't want to hang on those ligaments, right? You want to stand up straight. You see how her ears are lined up with her shoulders in this picture, and her chin is nice and tucked. So this is forward chin. See how the chin kind of jets out? That's not good. But this here, she's tucked it in. So ears lined up with shoulder. That's where your neck needs to be. Okay. Same thing with like when we have a sitting job, a lot of us now are working from home or desk job. That's what's taken over. So having a separate keyboard for a laptop, because laptop keyboards are so small and you're always hunched over it. So if you have a bigger one, it's better because then your wrist is better aligned, your neck is better aligned. Having a neck screen monitor, like it's eye leveled, right? So right here, eye level. So you're not peeking up or peeking down. And then in terms of sleeping here, you want to make sure your neck is supported. That's another thing too. So you see how this lady, individual that's sleeping, her neck is supported. So it's not like bent back or hunched forward. So if you do need to raise the head of the bed, if somebody has problems with like aspiration or choking hazards, yes, you can raise it. But then again, the neck needs to be neutral how it's laying here in this picture. Okay. Now, phone. Story of our life, right? Simply holding your phone and tablet at eye level can go a long way in reducing neck pain and strain. I can totally understand. None of us do this, let's be honest, right? We're all around here. But as the day goes on, look what happens with the posture. Look how much weight we are dispersing through our spine, right? So bending forward to look down while you're reading a book or looking at your phone, that's 60 pounds we're putting, versus if you're at eye level. So holding the phone up at the eye level, that's perfect amount because our head weighs also, right? You want to make sure we're keeping our spine safe and in correct posture. Tai Chi and yoga. So Tai Chi and yoga are both good examples of physical activities. They can improve not only balance, but it helps with improves your strength, flexibility, range of motion, helps you with like less fall prevention, physical functioning, and quality of life, right? So everything's going together. As you get stronger, you feel better, everything around you, and you yourself feel better. Most recently, mind-body exercises are recommended as co-treatment options for people with knee and hip OA to manage pain. So co-treatments are working on your core muscles, like your abdominal. So it's not the rectus where you see people do crunches. It's more like engaging the deeper core muscles, which kind of lap around your hips or to your spine to stabilize the joint, right? So if that part of the pelvic is stable, there's more sturdiness or stability for hip and knee and OA. In a study of older women with OA, subjects who were randomly selected to participate Tai Chi for 12 weeks had 35% less pain and 29% less stiffness and 29% more ability to do daily tasks than those who didn't perform the exercises. So again, going back to physical activities, right? Tai Chi tends to be nice and slow, and that's where the balance really does come in. And to sustain a posture on our daily life, that's what we do. We sustain posture. I'd be standing, waiting in a line. So that's where it all helps down to. Aerobic exercises, okay? It's also known as cardio. It's sustained exercise in which your heart rate is increased. You're strengthening your heart and lung, and it leads to better fitness. This is also linked with improved mental health and burns calories, which help with healthy weight management. Okay. Does anybody want to give me an examples of aerobic exercises which they feel? Not all.
Working in the water in the pool
Mm-hmm.
quickly. Using
Yeah.
the water as a bit of resistance.
Yes, wonderful. Swimming is wonderful, yes. So simple examples like cross-country skiing, walking, biking, swimming, like Alan suggested, hiking, and Nordic pole walking are just a few examples. But let's not forget video games, mowing the lawn or gardening. These are all part of aerobic exercises, right? Like video games that actually have exercises built into it. Now, the recommendation by Health Canada for aerobic exercise is at least 150 minutes per week of moderate to vigorous exercise. Okay. So if you average it down, it's 30 minutes per day. And if that's too much, then you can split it down, right? It's how well you can tolerate. So you can do 10 minutes and spread it to the bouts throughout the day. So progression to vigorous and intensity exercises like sweating and out of breath can only say few words, right? So your vigorous exercises, like you can still talk in the smaller sentences, but not if you cannot talk. When you cannot talk, that's not vigorous, that's going beyond it, and that's what we don't need, okay? Before initiating exercise, especially like vigorous intensity, it's always better for any older adults like to discuss it with their healthcare professionals for the reasons, right? If somebody has a respiratory condition like asthma or cardiac condition, it's better to be taken care of that way, right? So exercises, whenever you start at your fitness level where you can tolerate it. It's easier to progress and safer to progress the intensity and frequency as the weeks go by or the day goes by versus jumping into something that is not tolerable for you, okay? Now, water exercise. Why is water exercise so good for arthritis? It's because pool therapy is an efficient way to achieve physical activities because it does all. It does flexibility, strengthening, and endurance. The reason why pool therapy is more effective is also because when you're in the water, there's that buoyancy factor. Your body is basically weighing less in the water than it would on land. The buoyancy of the water improves trunk stability and balance. And then the therapeutic pool, if you look around your rec center, depending on the temperature on the pool, right? Some keep it neutral, like around 33 to 36 Celsius. So the warmer temperature reduces the pain, it relaxes the muscles, improves circulation, and again, socializing, right? Big thing here to keep in mind is when you're going in the pool, yes, we feel wonderful when we're in the pool, but you want to start gradually slow because buoyancy is tricky. We feel good in there, we feel less weighted, so we tend to do too much too quickly. But what happens is when you get out of the water, we end up paying for that for the next few days, right? So it's better to not overdo, start out slow and then work your way up. The other thing you want to make sure is dehydration can occur in the water. So you're drinking water and replenishing yourself with fluids, okay? Cycling is good because it's low impact on your hips and knees. It helps improve the range of motion and strengthens and endurance, right? So again, you're getting that aerobic with physical activity with cycling. There are challenges to this because some people have trouble getting on and off the bike, right? So switching to a girl's bike because it tends to be a lower tandem on it versus a male one. Cycling does require, so if somebody has a knee stiffness and their knee is not bending 210 degrees, riding a bike like cycling will be difficult. However, at that time, you can replace it to a stationary bike. A lot of the gym facilities or rec centers have them, like they have a recumbent bike where you can sit with your back supported. Then you can just complete half revs. Rather than going around, you just do half revs, back and forth. So that also helps. If you're active enough and you can definitely do spinning classes or do outdoor bike. Right? Road bike. Again, those are physical activity combining with your aerobic exercises. Nordic poles, these are amazing, whoever invented them. They look less stereotypical to straight cane. A lot of individuals like, I'm not this old, I'm not going to use the cane. All right, then use the poles, right? So there are two kind of poles you find. The activator, all right? It's used more for balance and support, and elbows stay bent and plant poles, and you need to plant the poles beside the legs, okay? Whereas the fitness one, they're more for aerobic and elbows stay straight and poles are planted behind. So this one, if you see, this is the fitness one and this is the activator because you're moving with it. Your feet are moving with it versus right here. And you can also see the difference in the feet, or so the poles of the Nordic actually. If you see this one right here, those are, I call them stoppers, but they can be addressed as feet also. Do you see the difference on the shape? So these can be improved or changed, sorry, these can be removed for winter and gravel path, all right? And a lot of the Nordic poles, like depending on the variety, they do come with different stoppers at the bottom. For the snow, they have the hinges coming down. And for the regular gravel one, it's a little different. They don't have the spikes in them. That's what it is, the spikes, right? And I know Costco has them every now and then. But these are really good because bilateral support, right? It's giving you that support for both the sides when you're offloading the joint. So there's less shock absorbance, less pain. So you're not leaning from one side to the other. Your weight is being managed equally. It also helps with your core and upper body strengthening. So if you think about it, you're moving your hands, your trunk, right? So your hands are moving, your trunks are moving, and your legs. So you're getting that full body workout along with your core. And walking poles do not provide the same support as a cane. So that's another thing you have to understand that, right? The technique is important. So if this is something you would like to learn to use, we can definitely help you out with that. Now, what is in it for you, right? Like the guys pointing fingers at everyone. So strengthening, right? Again, a lot of evidence has shown that people with OA who have stronger muscles have less pain. They have better function, less risk for flare-ups, and better aging, right? Because you're preventing the osteoporosis getting worse in other joints. Stronger muscles can help reduce the stress and load on the cartilage joint. And with stronger muscles, you will have greater confidence that your knees or hips will not give out going down the stairs, right? So it takes out that whole anxiety, right? Like if I'm going down the stairs, I don't want to fall. So having those muscles stronger is important. And if you maintain strong muscles, you're less likely to get osteoarthritis in your other joints. So this is why, I guess, the importance of exercise, right? Be therapeutic or physical activity is important. Now, big thing, we all tell each other, we know this because we tell our kids this too. You use it or lose it. And now, as you might have noticed throughout your time in life, the muscle mass decreases as we age. And if we don't make a point to strengthen them or use them, right, we lose them. So studies have shown that we lose 10% of muscle mass between the age 25 and 50, and 45% more between the age of 50 and 80. That's a lot of muscle mass, right? But but again, going back, the good news is it can increase at any age in response to exercise. So again, use it or lose it. So exercising, again, it's important because we can build up on those muscle mass. And that's why, remember, we talked about whole aspect of having strong muscles. Now, how do we do this? Like, how do we build that muscle mass, right? First is like you can target the muscles with certain exercises. Form of resistance, right? Using TheraBands, ankle weights. This lady here is using a TheraBands. Are you guys all familiar with TheraBands? Yes. Just nod. Perfect, wonderful. So TheraBands activities or gravity, right? So sometimes, or body weight, sometimes we don't have these ankle weights or TheraBands at home, and that's okay because our body weight provides us with enough resistance, like doing squatting, planks, or just doing wall push-ups, using machine or exercise balls, and swimming. Now, Health Canada has recommended that at least 2 days per week, not 2 days in a row, right? Because when you do exercises, you want to give 1 day of rest break to see how your response was, how your muscles or your joints responded to it, and then go the next day, right? You want that rest break. If joint is hot and swollen, and this is going back to more of an inflammatory condition, right? Or sometimes with osteoarthritis, you'll see like, oh, my knee feels really hot or it's swollen. You don't want to do strengthening exercise those days. You just want to rest the joint and maybe just do gentle range of motion exercises like bending the knee back and forth. Now, exercise needs to be progressive. So don't think if I do 10 squats, I'm only going to do 10 for the rest of my life, right? Because you always want to challenge the muscles and challenge yourself too at the same time, right? So doing the same exercise for the same number of times with same resistance will not increase your strength, okay?
Oh,
If an exercise, yes, sorry. Oh, if an exercise feels easy, then you need to make it harder by doing something different to it, right? Either you increase the weight or you increase the reps, okay? Now, neuromuscular education, the reason neuromuscular training, it is important because it improves your control, concentration, and quality of movements through specific exercises. I know we're running low on time. Are we okay to keep going?
Absolutely, you're good to go.
Okay.
No worries.
All right. So as we mentioned, like using your joints properly is very important, right? So if you see this lady here, she's doing sit to stand. The first picture right here, very poor technique. You can see her knees are caving in. She's lifting her foot, and then look at her wrist. Versus a correct technique, right? You want to use the proper technique with any physical activities or activities is because it's important to not put too much stress through the joints. So you want to prevent the stress on the joint, especially if they're painful or damaged. Okay. So in this picture, like I said, ankles are rolling in, knees are rolling in, and overuse of arm to push. The lady on the one that says proper technique, look at her knees. They're straight ahead, toes are flat, and her bottoms is sticking out. And that's what you want. That's how we sit. If we sit like this, we're going to fall right out. So again, proper techniques with our physical activities or exercises prevents less stress on our joints. Now, strategies to manage pain. I think this is a big one, right? Now, pain is okay, but there are just two simple rules you want to worry about to take care of. So this is a pain scale. Whenever you go to the doctor's office, they'll ask you, 0 is no, 10 is a lot. Where do you rate your pain, right? So using medications, it may help decrease your symptoms short-term, right? So it's like masking, but will not do anything long-term to slow down the course of OA or damage the joints that can occur. As we know, medications can have adverse side effects too, right? Certain medications, the pharmacist always gives the pamphlets, and that comes with side effects onto it to be careful of. On the other hand, current research shows that a suitable exercise program and weight management can slow the progression of osteoarthritis symptoms, reduce pain level, and improve day-to-day function. Now, taking medication may enable you to be more active by controlling your pain, right? But that's only temporarily if you think about it, right? But exercises will help improve gradually. So rule number 1, going back to pain during exercise is okay. It is expected, especially when you're starting something new. As long as that is an acceptable pain, 0 to 5, right? That's where you want to see it at. People think that pain is a warning sign and then are afraid to exercise. Pain that is 0 to 5 is not dangerous or causing damage and is safe to exercise. And it is safe to go on about your everyday daily activities. If pain is 6 to 10 in that red zone, then you should either need to change your activity level or make it less difficult. But don't stop. Like if you started out with like 2 out of 10 pain and you're finding after an exercise the pain is jumping to 8, then no, you need to stop, reassess yourself to see if are you doing something incorrectly to an exercise? Can you make it easier? Or how can you change it, right? So if you're doing 20 of something, maybe drop it down to 10 and see if that works. So that's rule number 1, right? Not to stop, but see how you can exercise with some pain, not a lot, not the red zone pain. Rule number 2 is any increase in pain after exercise should go back to normal within 24 hours. So that's the key word, within 24 hours, because that's known as muscle soreness, which is fine. But if it doesn't, then you should adjust your exercise for next session, because that means you have loaded the joint and caused enough stress to it. Does that make sense for everyone? I just take simple nods now. All right, wonderful. So these are the 2 big concepts, right? So don't be afraid of pain. As was, it's within that 0 to 5 realm, right? And pain should not last more than 24 hours. So those are the main keywords. Now, supportive shoes. So how can we do this? Supportive shoes, right? If you look at this nice shoe up there, lace up or Velcro. The reason why it's important for lace up and Velcro is because if you have swelling, you can adapt to the swelling through the day. Soft upper sole, because it will help with like the knee bends when you're doing exercises. Deep or wide toe box to accommodate for our toes so we're not getting squished in there. Good arch support like cushion, and non-slip, right? I mean, obviously you don't want to be wearing like shoes that are flat surface right into the gym because you never know when you could flip. Firm heel counter to give us that absorbing of the shock. Heel collar, make sure this is not broken. A lot of people sometimes they have this that are broken or they have cracks in them, but they still wear them. So heel collar, the reason why it's there is to support our ankle, right? This is where the ankle stability is coming from. And the heel is anywhere from 3 to 3.5 centimeters wide for stability. Again, for the knee and the foot, right? Because everything goes up the chain. If your feet is nice and supported, think about less pain through your knees and then through your hips, right? Everything goes up the chain. So wearing a shoe with these characteristics, it's as much as possible. So when you're looking for alternative shoes, try to search one with these characteristics. So even for winter shoes or dress shoes, try to look for something like that, especially the non-slip and sole cushion. Individuals with abnormal foot alignment, right? Decreased arch or flat feet, they could also benefit from inserts. Those are provided by orthotics, orthopedic or chiropody, as we say it here. So those are the ideas for your supportive shoe wear. Gait aids. Now, so remember, straight cane works differently than our Nordic poles. Some people with OA will walk with a limp, and this can help with pain, muscle weakness, unstable joints, or habit. If you keep walking with the limp, this will put more stress and cause more muscle weakness and more pain. So the reason, so here's a question to ask you. If you're having pain on the right side, where do you think you would hold the cane? On the right or the left? Anyone?
The left side, I think.
Yep, wonderful. So you always hold the cane to opposite painful joint, always. We tend to think it goes on the same side, but you want to disperse the force with during unloading time, and that's when you hold it towards opposite side. The height of the cane, as you can see in this lady, it should be measured at wrist level with arm straight. There's a little bend at the elbow, very little, not a lot, but it's from wrist to the floor. So that way you're not hiking through your shoulders or shrugging in as you're using it. Now, knee braces are also ways for pain management, right? So this is whole slide going towards a pain management. So knee braces help some people with osteoarthritis. There are multiple kind of knee braces, as you can see. This one is an unloader for osteoarthritis on this picture, as you can see, how the directions of the force is. So right here and right up here, okay? So what it's doing is supporting the patella, which is your kneecap. The way it stabilizes, so your kneecap is not shifting outside. Oh, sorry, laterally. If knee braces tends to be a little bit more bulkier, if somebody doesn't like that, they can always use a knee sleeve. I don't have a picture of a knee sleeve, but it's just a regular Neosporin sleeve, but they do have some patella support to help stabilize the knee. Now, this is also really important for joint protection. Pacing, which is breaking your activities into shorter periods of time. So if you know, sorry, anybody have a question? No. So pacing your activities, right? So if you know you have to cook and it's something that is painful for you, break it down. So you might start off by taking out the dishes and then chopping vegetables, taking a rest, and then cooking. So do you see how we just paced it down? So you can alternate between sitting and standing while you're cooking. You can sit to chop vegetables if you're able to, and stand to cook, right? I've seen individuals who stand and cook too. I mean, it's what works best for you and how you're able to manage it. Devices. Now, individuals with knee pain can wear a knee brace, right? Those are a part of a device. Change the method, right? Like how you get out of the chair. I'll show you the next slide on that one. Sorry, change the method you get out of a chair, sorry. And by that means is like from the lady when you saw before, if you scoot yourself up from the edge of the chair, like if you're sitting all the way back to the back of the chair, it's much harder to get up versus if you're coming closer to the edge of the chair and then getting up. Does that make sense for everyone?
Yep.
Okay. Local resources for physical activities, there's plenty out there. In the community you live in, if you go into your community website, you can look through what's available. Now, challenges, these are harder. Things that will not want to make us get out of the house, right? Too tired. We have a fear of it, not in a good mood, bad weather. That's a big one with everyone. Or we're too busy, right? But the whole thing is how we put our mindset to it and we want to function, right? We all are going to be busy in our life always, but it's how much time we take out for ourselves, right? So for all this, you want to choose activities that make us happy, that make us feel good, so we can work towards this, right? So don't feel tired to do something. If you enjoy dancing, I'm just picking dancing example because I feel like it's happy for everyone. Then you want to go out, even though if it's bad weather and if it's safer to go out, people will go out because you enjoy doing things. So you want to do things that help you. Now, the big thing here is SMART goal is how to be successful, right? So you want to pick activities that are fun. There's a variety of them, right? Not doing the same thing over and over again, because then we get so used to it, we get bored out of it, and we don't want to do it. Rewarding ourselves, like, okay, so here's my plan. I'm going to go to the gym 3 times this week. And if this happens, this is what's going to happen. This is how I'm going to reward myself. Oh, I might get myself a coffee from Starbucks, right? Rewarding yourself, because then you're looking forward to something. Wearing Fitbit or Garmin, right? Just to catch your step coins, to motivate yourself. Again, a SMART goal. I'm going to walk 10,000 in next 2 days, right? And if you have questions, you can follow up with your therapist. So hopefully this workshop, now I really like this. If you always do what you always did, you will always get what you always got, and you'll always feel how you always felt, right? So I'm hoping this workshop had inspired you to change and challenge yourself and given you a tool to do so. Arthritis Society therapists are here, like as one of myself, like we're here to help you and achieve these goals, right? If you like, so this is like our website. This is the example of the website that you can go to. You can self-refer yourself to see one of our AREP therapists like myself, or you can have, if your physician refers you for any form of arthritic conditions, we can happily see you. But there are a lot of resources available here. There's support groups. There's Living Well, which does have to with healthy treatment. Like if you're taking a particular medication, there are a list of slew of common medication in there that you can read up on. These are support groups that are available. There are online learning like this one that we just had. So these are also available online to see through. So this was a short introduction of managing osteoarthritis, and we have many more: mindfulness, meditation, foot arthritis, and sleep, like it says. But if you need, and if you're interested in like to join our workshops, the number is 1-800-321-1433 extension 3307, and you can definitely self-refer yourself, right? Because there's many kind of form of arthritis, okay? Now, does anybody have any questions? Well, thank you everyone for letting me speak to your wonderful group, and thanks for participating, everyone. I loved it. I hope it was helpful for you. And if you ever need us, you know where you can find us all.